Hello everyone, this is Justin Brown again, and in this video we're going to go over the second view of the stride face for the overhead throwing motion, the behind view. There are several things that we're going to be really looking at in this view. The direction toward the plate, foot orientation, shoulder external rotation, shoulder horizontal abduction, and the lead shoulder. For the direction toward the plate, if you have a model that we have here that has a white line through it, it makes it very easy to see where that foot is stepping. So as we go through, and we see where he lands right by that white dot. So that's pretty close with it. So you should be within 10 centimeters of either direction. So for every centimeter open, you have an extra 3 newtons of anterior force on the shoulder. If it's correct, you have less shoulder internal rotation torques and less elbow valgus forces. They land open, the hips and or core rotate early, but if you land closed, you will typically see them throwing across the body. So this is a very important aspect to ensure to help limit stresses on the body and help set up for the rest of that throw. So for the foot orientation, we can look at the degrees with it. So we should be within 15 to 19 degrees towards the throwing shoulder. So let's take that angle here. So it's pretty close. It's just a little bit more pointing towards the front shoulder instead of pointing towards the plate. So we'd want to correct that a little bit to get them pointing a little bit more forward, but it's pretty close with it. So if you're landing with the foot open, you can cause the pelvis to rotate early. But if you land with a closed foot position, you can cause the pelvis to rotate late or decrease amount. This is one that you can see on both views. So for the next thing we're going to look at, we want to look at our shoulder external rotation. So we're going to look at it right here. Now it should be within 45 to about 53 degrees. So we're looking, that's right about in that good range there. So we're right around 49 degrees. So that rotation of that shoulder right there is right within the limits that we want. So if you have an increased rotation, you have increased shoulder anterior force and elbow medial force. If you have excess rotation, you will see the arm close to vertical at stride on foot contact, and the decreased rotation you will typically see is an inverted W. So this is a very important one to make sure you limit those stresses on that medial elbow, which is that thing that leads to that Tommy John surgery. So next, we're going to look at the shoulder horizontal abduction. This one can be a little bit hard to see at times, but the biggest thing you're looking for is that point of that elbow and seeing where it winds up at. If you see elbow and it's lined directly in line with those ribs, then you know that you don't really have much of that abduction or that elbow dropping back. Now you shouldn't see the elbow so far back that it's all the way back behind the back either. It should be in between those two, and that will give you a good idea that's right around that degrees that you want, which is around the 23 to 30 degrees. Now increased causes an increased anterior shoulder force and medial elbow force, where decreased causes increased medial elbow force. So the different ways that you can see this on the video is that excess horizontal abduction will appear like the arm is lagging behind, or the hand path is behind the back. So if the elbow and everything looks like it's back behind the back, you have too much shoulder abduction. Where a decreased horizontal abduction, you will see the elbow in front of the chest, or it's going to look like they're leading with the elbow. Now for the lead shoulder, you should have a closed trunk position. The lead shoulder directed at the plate, so we can see that lead shoulder is pointing towards that plate because we can't see the front shoulder in front or behind here. We want to also look to check to see early rotation or an open trunk cause increased shoulder internal torques and elbow valgus load. The open trunk position will look like the lead shoulder is pointing towards the non-throwing side. So this is that point that since we don't see the shoulder either way, it points to us that we are pointing towards that plate, which is where we want it to. So, other part is excessive closed appears as lead shoulder is pointing towards the throwing shoulder side, or it'll be pointing, or the open trunk position is pointing towards the non-throwing side. It's not typically common to see, and you can see it on both sides, but we can again see on this one, this is very good with it. So those are the main points that we're going to look at with the stride phase and the behind the view section.